A very warm welcome to all of you joining us today from all corners of the world. Welcome back to Global Youth Mobilization's virtual celebration events and to our side event, the Youth-Led Solutions Showcase. Follow us and share your comments on Twitter, Facebook, or Instagram using the handle GY Mobilization and using hashtag Unstoppable Together or hashtag Youth Mobilize. I'm your host for today's side event, Jayati Modi. Hailing from India, I am an undergraduate student currently studying economics, and I've had the pleasure of serving as a youth panelist for GYM and working closely as part of the GYM team on the Accelerator program. I sincerely hope you enjoyed the main virtual event and left it feeling as we did, that young people are indeed unstoppable together. During the main event, you heard from projects delivering youth-led solutions across our 4 thematic areas. In this side event, we will be taking a deep dive into one of those themes, one that has been the founding causes of GYM: COVID-19 prevention, vaccines, and combating misinformation. In this event, we will hear from 3 innovative and inspiring projects from across GYM's 3 core programs: national projects, local solutions, and the Accelerator program. Now, we have with us today here the Squeaky Clean project, an Accelerator program project led by Raquel Daniel. Next up, we have Mobilizing Young People for COVID-19 Response, a national project under YMCA led by Pius Manna. And lastly, we have the Africa NCD Champions podcast, a local solutions project led by Stephen Okweno. We're also incredibly lucky and honored to have a leading expert on the topic with us today, who will share valuable reflections with the projects and take questions from the young people leading them. It gives me great pleasure to introduce Ms. Tina Purnat, Team Lead for Infodemic Management in the Unit for High Impact Event Preparedness, Department of Epidemic and Pandemic Preparedness and Prevention at the WHO. Her experience lies at the intersection of health research, analysis, and policy making, with an emphasis on digital health systems. She's also the proud recipient of the WHO Pathfinder and Innovation Award 2021. Tina, thank you so much for joining us today. And without any further ado, let us begin with the event. Raquel, I'd like to invite you to introduce yourself, lead us into your project showcase, and then pose your question for Tina. Over to you.
Hello, everyone. My name is Raquel Daniel. I'm the team lead for the Squeaky Clean project in Abuja, Nigeria. The Squeaky Clean project is focused on hand washing and helping children stay in school, reducing absenteeism, and also fighting COVID-19 and other breakout that may come out later in the future. Thank you. The Squeaky Clean project is in Nigeria. Specifically in Abuja, Nigeria. It started as the response to COVID-19. We realized in 2020 that a lot of children were going to be out of school, and we're not sure how long that would be. So we provided writing materials for them to ensure that they learn while they're out of the classroom for the period of time that COVID was, in the world. So what we noticed during that time was that the children didn't have information about COVID-19. To respond to that, we decided to write a book that would teach them about COVID-19. And then we started to visit schools that were closed, but we're using communities and we're using volunteers in different states to educate the children about COVID-19, so just that they can get the information that they need to stay safe during the pandemic. In the process, we realized that to fight the pandemic, the kids needed to learn about hand washing. And then we wrote another book that was targeted at hand washing and absenteeism in school. What we've done in the last 3 years with the project is ensure that the kids not only learn about COVID-19, but also they learn a lot about what they will do to stay in school if they don't fall sick, and also simple ways that they can fight the outbreak if there's ever an outbreak again in the world. During the time, we've used a lot of volunteers who were working with us. Some had never volunteered before. It was their first time, but then they were very helpful to us. And then we used loudspeakers. We We went from school to school when schools resumed, or we're just doing, we're basically teaching them about COVID-19 and how to keep themselves safe. And we did that for about 2 years. Our major challenge was funding, but thanks to Global Youth Mobilization Fund, we got money to produce more books, and we reached 35,000 children in total, giving them face masks and hygiene materials that they need to keep themselves safe. Right now with the project, what we're doing is we've installed 2 hand washing portals in school where children can wash their hands and be able to stay safe while they're in the classroom, and that will help them to fight absenteeism. What we're doing right now is also we started a club in school where the kids are learning after school every Wednesday how to wash their hands properly and then teach their friends. It's called the Germ Busters Club, and also teach their friends how to be safe if there ever is an outbreak or to fight cholera or any other disease in their schools. So our clubs are going well. The kids just resumed school and everything is going very well. So our proudest moment for us is the fact that we not only published 2 books, one on COVID-19 and one on hand washing, but also we have clubs that would outlive our projects. So even if we don't have funding anymore, our projects continue to run both in the IDP camps and in different schools. And then the kids have access to the books at any time. We can always reprint and continue to teach them about COVID-19. My advice to young people would be to collaborate and to not give up, because there's always going to be challenges in the world, but it's our responsibility to tackle these global challenges. Thank you. Okay, so my question to Tina today would be, in the course of our work in 3 years, we realized that there were shadow pandemics, and a lot of adults were educated about these. But for children, what would be your advice on simple steps that we can use to educate them about shadow pandemics, such as child abuse at home, especially when there's a lockdown and they're stuck at home with parents or guardians that would abuse them? So what are those steps that we can use to educate them about the shadow pandemic? Thank you.
Yes, thank you very much. Can I first just say that I really like the name of the project? It shows really good humor, and it's important when we work with each other. I like it very much that when the team was working with children, they learned from the children and what matters to them. And then they created more ideas on what to do. So I really congratulate the team. It's a very, very creative way of working with the children in ways that matter. And I really imagine that the kids will use this knowledge to keep themselves safe and also actually share it with their families. I can see how this project could be expanded to cover even more health topics, and can imagine them implemented in other schools across the world as well. And now what Raquel's asking about is actually really important. So what could we do? Well, I would say raise your voice. Take part in a community dialogues and feedback sessions when you get the chance. Conduct research on what avenues are available to you to advocate for issues important to you. And whether that is with a local advocacy group or joining a neighborhood community group or even an online forum where you can connect with like-minded individuals. Document your experiences, share it with policymakers and elected officials, and write letters to the editor for your LinkedIn page or for a journal, and share country experiences with others. Become part of the solution by supporting the causes important to you with your hands, your heart, and your head. You may just discover a lifelong passion for a specific health or social cause that may influence your future educational path or maybe your career choice, and make the world better for the most vulnerable.
Thank you so much, Tina. And I agree with you when you say that you love the project name. I think I love the Germ Busters Club as well. I think Raquel is really innovative with her names. So kudos on that. Moving on. Pius, I'd now like to invite you to introduce yourself, lead us into your project showcase, and then ask Tina the question that you have for her.
Hello, I am Pius Mana from the YMCA of Sierra Leone. And of course, I'm from Sierra Leone. And today I'm going to share with you our reflection on the GYM projects that we implemented. our project was titled Mobilizing Young People for the COVID-19 Response. So I'm going to share my reflections with you on this project. So our project was implemented in Sierra Leone, and the title of our project was Mobilizing Young People for the COVID-19 Response. And our problem was actually using young people because they were the most affected, and they were the ones that the pandemic really reached hardly. And because of this, young people, the violence rates among young people increased, especially the sexual gender-based violence, and unemployment also increased. So for young people, and especially for vulnerable youth, the COVID-19 crisis posed considerable risk in the field of education, employment, mental health, and also in their disposable income. So in Kenema, one of the project locations where we implemented, a statistics shows that about 62% of women aged 15 to 49 reported having experienced physical or sexual gender-based violence. And also the statistics from Rainbow Initiative shows similar figures. And what was the problem? And how did we tackle it? So the project aims was to prevent the spread of COVID-19 through social mobilization, campaign on sexual gender-based violence, and awareness raising on COVID-19 vaccination for a period of 6 months. So how did we go about it? So what did we do? We trained a lot of young people in different facets. Some were peer educators and some were people that were raising awareness, but it was actually led by young people. The process was led entirely by young people. So who were our beneficiaries and how many beneficiaries we reached? So directly we were able to reach around 100 beneficiaries with our direct project intervention, ranging from training and peer education, as the case may be, and also giving out of grants. Indirectly, we are actually able to reach about 1,000 people with different models or with different distribution mechanisms. So what was our biggest challenge? Our biggest challenge was actually selecting beneficiaries because we had a lot of beneficiaries that we wanted to reach, but the funding was limited. And our biggest learning point was peer influence is a mighty force to reckon with. Young people can actually influence other young people. Our motivation is there is hope for young people, and young people can actually be the change and create the change that they want to see. And yes, we can save the future, and we can save the future for millions of other young people out there as long as we as young people keep working. And see some photos of some of the work that some young people did. I want to thank you very much for spending some time to listen to me. Do have a very great day. Thank you. Thank you. And I'm sending a quick question to Tina. Us as young people in Sierra Leone, our project was actually focused around COVID-19. And COVID-19 really taught us harsh realities, while also presenting us with new ways and possibilities of doing things. What do you think are the lessons we can take from the pandemic to help young people become more resilient to future shocks or pandemics?
Well, what I really like about this project, again, is that it paired up COVID-19 awareness and prevention measures, but at the same time addressed the biggest concerns and biggest challenges that young people were facing. What stood out for me is the peers, peer-to-peer educators. Peers can discuss topics of concern in ways that others cannot. And I like that so many volunteers were trained to work in their community. I really do hope that all the peer-to-peer educators that were trained for this outreach and campaigning can stay connected and can help with other health education initiatives through the YMCA network. Now, Pius actually asked a really important question, and there's many different lessons and takeaways from our experience. Here's just a few thoughts. I think that the pandemic had a way of distilling what was important and what was not. Many of us experienced, what we experienced was that we can't take our mental health or the mental health and welfare of those around us for granted. Anxiety, isolation, uncertainty, and loss. These are all experiences we have all had to some extent, or we know someone close to us who felt these things. So I think we can help promote resilience within ourselves first, which will serve us well in our day-to-day lives and when an emergency strikes. Resilience from a mental health perspective can mean learning tactics like mental health first aid to help others in a crisis. Resilience can also mean emergency planning for your family to be ready in case of a crisis, and ensuring that more vulnerable family members are taken care of, such as your grandparents. Resilience also means fostering and building a strong social network to support that you can rely on in times of crisis, and one that will share information with you, ideally accurate information, and one where you can also help others through. Now, these are just some ideas, but you are all young people who lived through the pandemic. You would be the best able to tell me what you think would help young people like you be more resilient to future shocks. And your experience is very valuable. Share it.
Thank you, Tina. That was really insightful. Next, we have the third project, the Africa NCD Champions podcast. Unfortunately, the project lead, Stephen Okweno from Kenya, couldn't join us today. However, he has shared a video showcasing his project as well as posing a question to Tina. Here it is.
Hi, my name is Stephen Okweno. I'm 27 years old. I'm from Kenya, and I was the person who was running the Africa NCD Champions podcast. Now, the problem that the podcast was tackling was the problem of COVID-19. And here we are looking at COVID-19 and non-communicable diseases. And so in this podcast, we wanted to share what was the problem that we had, especially for the communities living with non-communicable diseases, what are the challenges that they face, and also what are some of the lessons that we could learn from COVID-19 to help us prepare for future pandemics. And so the project itself was titled the Africa NCD Champions podcast, and it was a way to bring voices of young people living with non-communicable diseases to share their experiences during COVID-19. It was also a way to share useful information on the links between COVID-19 and non-communicable diseases. And also, more importantly, it was a way to share valuable lessons that we could pick from COVID-19 to help us prepare for future pandemics. The project involved a 10-episode podcast series, which was both in audio and video format. And we also did 3 community dissemination forums and events on the podcast series to ensure that other members of the community who might not be able to access the podcast online still benefited from the lessons from the community. Some of the challenges that we faced included financial challenges, where it was a bit hard to disseminate the project further. And so a lot of people have shown interest in wanting to engage in further episodes and sharing their experiences. However, due to limited resources, we couldn't be able to accommodate all of them. Moving forward, we are looking at the achievements and learnings that we had. And some of the biggest achievements that we had with this project is that we were able to reach over 437 young people in person during the 3 community dissemination events that we had. We finalized a partnership with Sterling Foundation to disseminate the podcast series even further through online platforms. And also, one of the biggest learnings that we had is that we could be able to adopt technologies like podcasts to be able to create and amplify the messages further, showing that technology indeed has become a way to move the needle forward when it comes to health, work, and advocacy. My parting shot would be that as young people, we have the energy, we have the innovation, and we have the skills to be able to create global impact. And so we must embrace that power, and we must embrace that energy to help us continue to tackle these global challenges. And with that, thank you. And as we say on the podcast, see you on the next one.
And my question is this: what support networks are out there for young people trying to address misinformation and raise awareness on COVID-19 and health issues via platforms like ours in communities?
Yeah, thank you also to Stephen for this inspiring presentation. People who are living with non-communicable diseases are at higher risk from having complications from COVID-19 and other infections. And I really liked that the community sessions were also held to promote the podcast conversations. It's a great way not only to connect those who are living with NCDs, but also to give others in the community an opportunity to listen about their experience and discuss it. It's a good way to ensure that credible and relevant health information is shared, and this can help contribute to preventing us from jumping to conclusions or believing misinformation about those topics. The beauty of this is that technology channels don't know borders, and imagine if there were more young people producing community health podcasts like this one. Now, about Stephen's question, there are actually many support networks for young people trying to address misinformation and raise awareness. It really depends on the community. For example, there's young medical university students who began an association specifically to address medical misinformation. In other places, young people have supported civil society organizations and worked to help fact check health misinformation or teach digital literacy skills to older people who might have trouble telling the difference between high and low quality information. Other young people, they have used their unique skills to address misinformation, such as through art and poetry, speaking in a way that is trusted and understood by their peers. Some young people have recommitted to communicating in tribal languages so that they can communicate with their elders about COVID-19 and encourage them to get vaccinated. And this type of innovation is happening everywhere. The best part about being a young person is that no one will tell you how to fix the challenges you see around yourself, because you can find creative solutions yourself. We have seen an explosion of creative problem solving by young people during the pandemic, and I hope that it continues. Meanwhile, there are now more opportunities for educational advancement in infodemic management, with free online courses from WHO on infodemic management 101 that you can take, and apply to more fellowships that focus on health information all over the world. The world is your oyster. You should grab it with both hands.
Thank you so much, Tina. I think I really resonate with the point where you said that such technology processes no boundaries. I think that's the beauty of global movements like GYM. They absolutely no borders or boundaries. They're all over the world, and it's everybody coming together, irrespective of where we're from. So thanks a lot. Today, we saw before us an incredible showcase of some of the most innovative and impactful projects supported by GYM from around the globe. I'd like to thank these projects for sharing their passion and work with us, and to congratulate all of GYM's projects that have delivered youth-led solutions for COVID-19 prevention, vaccines, and misinformation. Thank you so much, Tina, for being a part of this event and bringing your knowledge, expertise, and advice for all of us to benefit from. We really appreciate it. All of the events from today will be available to rewatch afterwards. And please do check out our other youth-led solutions showcases for our 3 thematic areas. Don't forget to share your thoughts or comments with us via Twitter, Facebook, or Instagram. We're going by the hashtag youth mobilization, hashtag unstoppable together. And before we close, a huge thank you to all of you for joining us today. If you're a young person, we hope that you were inspired and encouraged to continue the important work that you do in your communities. If you're an ally, we deeply value your support and hope that you are left even more determined from this event to invest in the potential of young people. I think this event was true to the statement that we are unstoppable together. Thank you.